Let me tell you about the most expensive lesson the tech industry has ever learned. For years, Silicon Valley thought they could revolutionize healthcare with pure technology. They hired the smartest programmers, raised billions in funding, and built digital systems that looked incredible on paper. But when these systems hit real hospitals, complete disasters. Algorithms that couldn't tell the difference between normal and critical patient data, digital tools that nurses couldn't use because they ignored basic clinical workflows. That's when tech companies realized something that cost them millions. You can't build healthcare technology without healthcare professionals. I stumbled into this gold mine completely by accident. I was working as a registry nurse, picking up shifts wherever they needed me, barely making about 65, 70K a year. And when I got a LinkedIn message from a digital health company, he said, "We built a system to predict patient deterioration, but our hospital pilot is failing in a NICU. We need someone who actually understands patient care to help us fix it." I thought it might be a scam, but curiosity got the better of me and I agreed to a consulting call. What I discovered on that call changed my entire understanding of my own value. This company had spent years and billions on digital systems that were supposed to alert nurses when patients were getting sicker. Sounds great, right? But when they tested it in the real hospital, it was sending alerts every 5 minutes for things that weren't emergencies. Nurses were ignoring the system completely because it was crying wolf constantly. The new boss told me, "Our programmers are brilliant, but they don't understand what nurses actually need to know and when they need to know it. We need someone who's been there." That's when it hit me. My clinical knowledge wasn't just valuable in hospitals, it was pure gold to tech companies trying to build healthcare solutions. Once I started looking, I saw this pattern everywhere. Tech companies building telehealth platforms that doctors couldn't use, smart digital diagnostic tools that missed obvious clinical red flags, electronic health records that made documentation take longer, not shorter. The problem wasn't the technology, it was that brilliant programmers were trying to solve healthcare problems without understanding healthcare. And here's the crazy part: these companies were all desperately looking for the same thing: clinical professionals who could bridge the gap between technology and real patient care. Let me break down exactly what these companies are paying $150,000 a year for, because it's probably not what you think. Clinical validation. They need us to look at the AI outputs and say, yes, this makes good clinical sense, or no, this could hurt patients. They pay $75 to $150 per hour for this because our clinical judgment literally saves lives. Workflow design. Programmers can build amazing features, but they don't know how busy nurses and doctors actually are. We design workflows that fit into real clinical practice. Training and implementation. When hospitals buy new AI systems and digital health systems, they need clinical experts to train staff and manage rollouts. We speak both languages, clinical and tech. Product development guidance. We help tech companies build solutions that healthcare workers will actually want to use instead of fight against. Now, let's talk numbers, because this is where it gets really interesting. Remember, I was making 60K, maybe 65 or 70 if I worked really hard as a registry nurse, picking up shifts wherever possible and wherever hospitals were desperate, dealing with different units, different systems, never knowing my schedule. Here's what clinical professionals are making in AI healthcare roles right now. Clinical AI consultant, 120 to 180,000 a year. Healthcare machine learning specialist, 140,000 to 200 annually. Medical AI product manager, 150K to 220K annually. But here's the kicker: many of these roles are remote, flexible, don't require you to work nights or weekends or be a programmer. I personally went from 60K to 160K and then 200K in 18 months. And I'm not unique. I went on to make $200,000 a year as a consultant. Doctors earning $250,000 as healthcare tech product managers. It's everywhere. You might be thinking, but I don't know anything about AI or tech or technology. Here's what shocked me. That's not what they're paying for. They don't need you to become a programmer. They have plenty of programmers. What they can't find anywhere else is someone who understands healthcare and how it actually works, knows what clinical decisions look like in real time, and can spot when technology will help versus hurt patient care. Someone who can communicate with both the clinical staff and the tech teams. And the tech stuff that you need, it's basic. Understanding how AI works in general terms, not building algorithms from scratch. Learning healthcare data standards, not becoming a data scientist. But here's where it gets even better. Once you establish yourself in digital health, with some basic AI skills, some basic digital health skills, you can build multiple income streams. Consulting that pays $75 to $150 per hour, helping companies implement digital health and AI solutions. Speaking, 5K to 15K per conference presentation about AI and digital health in technology in healthcare. Course creation, teaching other clinical professionals about AI transitions. Advisory roles, 2 to 10,000 a month for guiding startup product development. I know clinical professionals pulling in 300K annually by combining a base salary with consulting and speaking. It's the same clinical brain, just applied to digital health and AI problems instead of bedside care. Remember that failed digital system I told you about at the beginning? After I helped them fix it, patient satisfaction scores went up 40%. Imagine that. And nursing efficiency improved by 25%. That's real money. But here's what really mattered to me. I made more money in those 3 months of consulting than I made in an entire year of registry nursing. And I was helping thousands of patients indirectly instead of just ones I happened to be assigned to on whatever unit needed coverage. That's when I realized the tech companies weren't making mistakes. They were repeating the same pattern they learned from electronic records. Build first, fix later, pay clinical professionals premium salaries to make it actually work. It's expensive, but it's apparently how the healthcare tech industry operates. So here's the truth about this digital health and AI healthcare gold rush. It's happening right now, and most clinical professionals don't even know about it. While hospitals are struggling with staffing and burnout, tech companies are literally competing for clinical professionals who understand AI basics. They're offering starting salaries that are 50 to 150% higher than hospital pay, remote work options, stock options, and equity, flexible schedules, no nights, no weekends, no holidays. The companies that made billions from electronic patient records by eventually hiring clinical professionals learned their lesson the expensive way. Now, AI companies are repeating the exact pattern, and they're going to pay even higher premiums to clinical professionals who can help them avoid the same costly mistakes. If you're sitting there thinking, I want this life, here's what you need to do. First, stop thinking of yourself as just a nurse or just a doctor. You're a clinical expert with knowledge that tech companies desperately need and can't replicate. Second, start learning basic AI concepts, not programming, just understanding how AI works in healthcare. There are specific pathways designed for clinical professionals. Third, start positioning yourself as someone who bridges clinical knowledge and technology. That positioning alone will open doors you didn't even know existed. Look, I've created a free guide that shows you exactly how to transition from traditional clinical work to these high paying and digital health and AI healthcare roles. It includes real job descriptions, salary ranges, and the exact steps that I took to go from 60, 65K to 160 and then 200K. Comment Goldmine below, and I'll send you the link. And make sure you subscribe because I want to share new AI healthcare opportunities every week. The tech companies have learned their lesson about trying to build healthcare AI without us. The question is, are you ready to be compensated for fixing their expensive mistakes?